The following nerves ascend in the tracheoesophageal groove. Just now we are discussing about the relations of arch of aorta. In the right side, the arch of aorta is related with the trachea and the esophagus. So, in the groove between the trachea and the esophagus, you find the recurrent laryngeal nerve. Now, this recurrent laryngeal nerve, on the right side, it winds around the subclavian artery. On the left side, the recurrent laryngeal nerve winds around the arch of aorta. On the right side, the recurrent laryngeal nerve winds around the right subclavian artery. On the left side, the recurrent laryngeal nerve winds around the arch of aorta. So, left recurrent laryngeal nerve has got thoracic course also, apart from the cervical course. So, in front of the trachea, you find the thyroid gland. In front of the trachea, you find the thyroid gland. Now, the lateral lobe of the thyroid gland on the medial side, it is related to two tubes, two nerves, we say like that. So, two tubes are trachea in the esophagus, two nerves are left recurrent laryngeal nerve and the external laryngeal nerve. So, this left recurrent laryngeal nerve is a branch of vagus, left vagus. It is winding around the arch of aorta, closely related with the ductus arteriosus. Now, just now we have said ductus arteriosus or ligamentum arteriosum. It is the branch, arterial branch, which is connecting the left pulmonary artery and the arch of aorta. So, because of the presence of that sixth arch artery, persistence of that sixth arch artery, the recurrent laryngeal nerve on the left side is winding around the arch of aorta, whereas on the right side it winds around the subclavian artery. So, superior laryngeal artery, the first option. Superior laryngeal artery is also a branch of vagus. Superior laryngeal artery laryngeal nerve divides into two branches, internal laryngeal nerve, external laryngeal nerve. Internal laryngeal nerve is totally sensory. It pierces the thyroid membrane and enters into the larynx and supplies the mucous membrane of larynx above the vocal folds. Whereas external laryngeal nerve is totally motor. The only muscle supplied by external laryngeal nerve is cricothyroid. All the muscles of larynx are supplied by recurrent laryngeal nerve except cricothyroid, which is supplied by external laryngeal nerve. Now, what about the distribution of this recurrent laryngeal nerve? After winding around the arch of aorta or subclavian artery, it is ascending in the tracheoesophageal groove and it is closely related with inferior cricothyroid joint. That is a way during the surgeries, how what is a landmark for identifying this recurrent laryngeal nerve is, it is present just posterior to the inferior cricothyroid joint. Then it enters into the larynx and supplies the mucous membrane below the level of vocal folds. Mucous membrane above the level of vocal folds is being supplied by means of internal laryngeal nerve. Mucous membrane below the vocal folds is supplied by recurrent laryngeal nerve. Then what is the motor distribution of recurrent laryngeal nerve? All the muscles of larynx except cricothyroid are supplied by recurrent laryngeal nerve. Then external laryngeal nerve. Cricothyroid is supplied by external laryngeal nerve. Internal laryngeal nerve is totally sensory, supplying the mucous membrane above the level of vocal folds. What about that superior laryngeal nerve? It is a branch of vagus which is dividing into internal laryngeal nerve and external laryngeal nerve. The following structures are present in the hilum of the lung except. So, the various structures present within the hilum of the lung. So, hilum of the lung is composed of various structures. Now, for the right lung, the hilum of the lung is composed of the pulmonary trachea is dividing into two principal bronchi. You call them as principal bronchi. On the right side, the principal bronchus divides earlier. So, you find the pulmonary trachea that is dividing into two principal bronchi. Right principal bronchus is shorter, wider and more vertical. Then it is dividing into eparterial bronchus, hyparterial bronchus. So, you find pulmonary artery, a bronchus present above, what you call it as eparterial bronchus, a bronchus present below, hyparterial bronchus, superior pulmonary vein and inferior pulmonary vein. These are the structures present in the hilum of the right lung. In the hilum of the left lung, you find pulmonary artery, then you find the bronchus, and then superior pulmonary vein and inferior pulmonary vein. So, on the right side, principal bronchus is dividing earlier before entering into the hilum of the lung. So, you find eparterial bronchus, hyparterial bronchus. In the middle, you find the pulmonary artery. Whereas, on the left side, you find the pulmonary bronchus directly entering into the hilum of the lung. So, the following structures are present in the hilum of the left lung: pulmonary artery, eparterial bronchus, inferior pulmonary vein and bronchial arteries. Bronchial arteries are present on both the sides. The bronchial arteries, they arise from the third posterior intercostal artery on the right side, and on the left side they are the direct branches of descending aorta. So bronchial arteries, they supply the bronchus. They are present on both the sides. Eparterial and hyparterial bronchi are present on the right side. On the left side, you find only the left principal bronchus. So what is not present in the hilum of the lung is, it is the eparterial bronchus. So answer is B. So eparterial bronchus and hyparterial bronchus are present in the hilum of the right lung. They are situated above and below the pulmonary artery respectively. For left lung, you find the principal bronchus entering directly into the hilum. The following structures are related to the superior surface of shaft of the first rib. So on the superior surface of the shaft of the first rib, you can see the tubercle. Along the inner margin of the rib, you can see the scalenate tubercle. To that scalenate tubercle, the muscle attached is scalenus anterior. The scalenate tubercle is separating, you can see the groove for subclavian vein and groove for subclavian artery. Then you can see the tubercle for scalenus medius. You can find a roughened impression for scalenus medius. So scalenus anterior and scalenus medius, they are attached to the upper surface of the first rib. And the scalenate tubercle, that is which is present on the inner margin of the first rib, that is separating the two grooves. The groove which is present in front of the tubercle is subclavian vein, and the groove which is present behind is for subclavian artery. So you find groove for subclavian artery, groove for subclavian vein, then you find lower trunk of the brachial plexus. Brachial plexus lower trunk is formed by C8 and T1. The T1 has to cross the first rib and then has to join with the C8. So you find it closely related with the upper surface of the first rib. So, but not the middle trunk of the brachial groove. Middle trunk of the brachial plexus is formed by the union between C5 and C6 and C7. So the following structures are related to superior surface of shaft of the first rib. So answer is middle trunk of brachial plexus. Lower trunk of the brachial plexus, as it is formed by the union between C8 and T1, it is closely related to the superior surface of the first rib. Then the following muscles are attached to the superior surface of the first rib except. So just now we have said there is a tubercle on the upper surface of the first rib closely related to the inner border of the first rib. That is what you call it as scalenate tubercle. That scalenate tubercle is separating the subclavian vein anteriorly and subclavian artery posterior. Then posterior to subclavian artery, you can find a roughened impression. That is what you call it as impression for scalenus medius. So the upper surface of the first rib is giving attachment to scalenus anterior, scalenus medius. Scalenus posterior is attached to second rib. Scalenus posterior is attached to second rib. Then what about the subclavius muscle? Subclavius muscle is attached to clavicle. On the undersurface of middle 1/3 of the clavicle, you find the subclavian groove. Below it is attached to the first. So subclavius muscle is also attached to the. So answer is D. Scalenus posterior is attached to second rib. So subclavius muscle is also attached to upper surface of the first rib. Scalenus anterior and medius. Then the following is true about neurocentral joint. Neurocentral joint means vertebra is being formed in two ways. The body of the vertebra, and then posteriorly you find the neural arch. So you find the body of the vertebra, then you find the pedicle, then the transverse process, then you find the lamina, and then the spinous process. So this is what you call it as neural arch. Neural arch is formed by the lamina and the spinous process. Here you find the spinal cord. So this neural arch fuses with the body of the vertebra. So here the total bony fusion is occurring. So what type of joint is this one? So it is a joint present in between the centrum and each half of the vertebral arch. So centrum is body and each half of the vertebral arch. It belongs to a variety of syndesmosis. So syndesmosis, we have said the two bones are connected by interosseous membrane. Here the bones are not being connected by interosseous membrane. In the upper cervical vertebra, centra unite with the body of there is vertebral arches about third year. Here total bony fusion is occurring. In lower lumbar vertebra, union is complete about sixth year. So it is not belonging to a variety of syndesmosis. What is there is synchondrosis. So here the wrong answer is B. It is not a variety of syndesmosis. It is synchondrosis. So the neurocentral joint belongs to a variety of synchondrosis or primary cartilaginous joint. So it is not a syndesmosis because total bony fusion is occurring. Vertebra is a single bone. Then the following is true about the left ventricle of the heart. The walls of this cavity are 3 times thick as that of the right ventricle. So, left ventricle is pumping the blood into the systemic circulation. Definitely the wall of the ventricle will be thick. It has 2 papillary muscles. It has got 2 papillary muscles, anterior and posterior. It has septomarginal trabecula, which is also called moderator band. Septomarginal trabecula is a feature of right ventricle. So, in the interior of the right ventricle, you find 2 portions. You find the inflow part of the right ventricle is rough, that is what you call it as primitive ventricle, and outflow part is smooth. So, you find the right ventricle, if you find like this, inflow part, right atrioventricular orifice, here it is being provided by means of tricuspid leaflet, and then you find the inflow part. Inflow part is rough, where you find the papillary muscles, whereas outflow part is smooth. The smooth outflow part is called infundibulum. Now, separating the inflow part and outflow part, you find a band. This is what you call it as septomarginal band. Septomarginal band is separating the rough inflow part and smooth outflow part. Then what is, this is called supraventricular crest, supraventricular crest. Now, what is septomarginal band is extending from the interventricular septum up to the base of anterior papillary muscle. In the right ventricle, you find 3 papillary muscles, unlike in left ventricle. In left ventricle, you find only anterior and posterior papillary muscles, whereas in the right ventricle, you find anterior papillary muscle, posterior and septal papillary muscle. Extending from the interventricular septum up to the base of papillary muscle, anterior papillary muscle, you find the septomarginal band, also called moderator band, which contains the right bundle branch, On cross section, left ventricle is circular. So, here interventricular septum is separating the right ventricle and left ventricle. The interventricular septum will be bulging towards the right ventricle. So, left ventricle we get, if you take a cut section, left ventricle we get a circular appearance, right ventricle, the interior of the chamber gets a semilunar appearance. So, the answer is C. Septomarginal trabecula is also called moderator band, that is a feature of right ventricle. The base of the heart, just now I have said, the base of the heart is being formed. Most of the base of the heart, 2/3 of the base of the heart is formed by the left atrium, and 1/3 of the base of the heart is formed by the right atrium. So, base of the heart is formed by following chambers of the heart, mainly by the left atrium and partly by the right atrium, right ventricle, right and left ventricle. So, answer is A. So, it extends superiorly up to the bifurcation of the pulmonary trunk, inferiorly up to posterior atrioventricular groove containing the coronary signs. Anterior atrioventricular groove is occupied by, marginal artery, that is passing along the inferior border of the heart. Right coronary artery, yes, that is present within the anterior atrioventricular groove. Circumflex artery, this is present in the left atrioventricular groove. Diagonal artery, that is present along the left margin of the heart. So, the content of anterior atrioventricular groove is right coronary artery. Apart from this right coronary artery, what is the other structure present in the anterior atrioventricular groove? It is the small cardiac vein. So, right coronary artery arising from the anterior aortic sinus reaches the anterior atrioventricular sulcus and descends, and then that is running in between this winding around the inferior border and reaches the crux of the heart, where it terminates by joining with the terminal part of circumflex artery. The following structures are related to the mediastinal surface of left lung. The following structures are related to the mediastinal surface of left lung. Aortic arch. So, aortic arch is present on the left side. It arches over the left principal bronchus. Just now we have said it is arching over the left principal bronchus. So, that is related to the left lung. Thoracic duct. Thoracic duct is a large lymphatic vessel which is beginning within the abdominal cavity. Now, the thoracic duct enters into the thoracic cavity through the aortic opening of the diaphragm. It ascends exactly in the midline. On reaching the 5th thoracic vertebra, the thoracic duct takes a deviation onto the left side, and then it arches, it is making an impression on the left lung. So, thoracic duct is related to the mediastinal surface of left lung. Then esophagus. Esophagus also, it makes an impression on both right lung and left lung. Azygos vein. Azygos vein is present on the right side. It arches over the root of the right lung and then terminates into superior vena cava. So, azygos vein makes an impression on the right lung, whereas arch of aorta, thoracic duct, esophagus. Esophagus, of course, it makes an impression both on right lung and left lung. Azygos vein makes an impression on the right lung. So wrong answer is D. So azygos vein, it arches over the root of the right lung and terminates by opening into superior vena cava. It is not at all related to the left lung. The mediastinal surface of right lung is related to the following structures. Mediastinal surface of right lung is related to the following structures except azygos vein. So azygos vein is present on the right lung. Then superior vena cava. Superior vena cava is formed by the union between right and left brachiocephalic veins. It makes an impression on the right lung. So because the right margin of the heart is formed by superior vena cava, right atrium, and then the inferior vena cava. Thoracic duct. Thoracic duct, we have said, it is taking a deviation onto the left side at the level of T5 vertebra. Trachea. Trachea is present in the midline, but tracheal makes a deviation towards the right side. So tracheal impression will be more on the right lung when compared to the left lung. So following structures are related to the right lung. Azygos vein is correct, superior vena cava is correct, trachea is correct. Thoracic duct makes an impression on the medial surface of left lung. So thoracic duct is not related to the right lung, it is related to the left lung because behind the groove for left subclavian artery and above the aortic groove. The number of intercostal arteries present in the fifth intercostal space. Any intercostal artery, it is composed of any intercostal space, it is composed of intercostal arteries. You find anterior intercostal arteries and the posterior intercostal arteries. So anterior intercostal arteries are the branches of internal thoracic artery. Every intercostal space, 2 anterior intercostal arteries are present. Then posterior intercostal arteries are the branches of descending aorta. In every space you find one posterior intercostal artery which divides into 2 branches and the anastomose with the anterior intercostal arteries of internal thoracic artery. So posterior intercostal arteries are the branches of descending thoracic aorta, single in number. Anterior intercostal arteries, in every space you find 2 anterior intercostal arteries which are the branches of internal thoracic artery. So 1 posterior intercostal artery and 2 anterior intercostal arteries. So total you find 3 arteries. So 1 anterior, 2 anterior and 1 posterior. So the right answer is B. So fifth intercostal space, that is any typical intercostal space contains 2 anterior and 1 posterior intercostal arteries. Posterior, remember the posterior intercostal arteries are the branches of descending thoracic aorta. Anterior intercostal arteries are the branches of internal thoracic aorta. Right posterior third intercostal artery gives rise to right bronchial artery. On the left side, bronchial artery arises directly from the descending aorta. Esophageal opening, there is a passing in the diaphragm, a respiratory diaphragm, transmits the following structures except esophageal opening. There are 3 main openings present within the diaphragm. Esophageal opening, then opening of inferior vena cava and the aortic opening. Esophageal opening, apart from the esophagus, the structures passing are the vagus, right and left vagus nerves. Then you find the esophageal branches of left gastric artery. So here esophagus is passing, gastric nerves, left phrenic nerve. Left phrenic nerve, it pierces the left dome of the diaphragm directly, whereas esophageal branches of left gastric artery they pass. Gastric nerves means related to the vagus. So the answer is left phrenic nerve. Left phrenic nerve does not pass through any opening. It directly pierces the left dome of the diaphragm. Right phrenic nerve passes through the opening of inferior vena cava. So left phrenic nerve does not pass through the esophageal opening of the diaphragm. It pierces the muscle of the left dome of the diaphragm in front of central tenon and supplies the diaphragm from its abdominal surface. Remember, right phrenic nerve passes through the opening of inferior vena cava. Following is true about the sinoatrial node except SA node. SA node is situated in the wall of the right atrial chamber. It is situated at the posterior end of crista terminalis, proximal end. Nodal tissue occupies the whole thickness of atrial wall from the epicardium to the endocardium. Impulses originating here spread out to the atrial musculature and reach the AV node. So through the conducting tissue from SA node through the internodal tracts, it reaches the AV node. So D is correct. Then it is situated at the upper end of the crista terminalis. So that is correct. And then it is situated in the right atrial chamber just below the opening of superior vena cava. Nodal tissue occupies only the 2/3 thickness of the right atrium. It does not occupy the entire thickness from epicardium to the endocardium. So sinoatrial nodal tissue does not occupy the full thickness of right atrial wall. from epicardium to the endocardium. So it is present just below the opening of superior vena cava at the upper end of the trunk, crista terminalis. The following is true about atrioventricular bundle, except it is in direct continuation of AV node. So SCA node is the where the impulse begins, then it passes through the internodal tracts, reaches the AV node. AV node is present in the triangle of Koch. Then through the AV bundle, the bundle of His, it begins. It branches on the crest of muscular interventricular septum. It branches on the crest of muscular interventricular septum. It divides into right bundle branch and left bundle branch. Right bundle branch enters into septomarginal trabecula and reaches the which papillary muscle? Anterior papillary muscle of the right ventricle, but not the posterior papillary muscle. Left branch diverges and passes subendocardially and reaches the ventricular septum. So here the wrong answer is C. So right bundle branch enters the septomarginal trabecula and reaches the anterior papillary muscle. The number of papillary muscles present in the right ventricle are 3: anterior, posterior and septal, of which anterior is the largest and receives the septomarginal band or moderator band. The following is true about serratus posterior superior muscle. On the posterior aspect, just beneath the scapula, you find the serratus posterior superior. Now it arises from the spinous process of lower 2 cervical vertebrae and upper 2 thoracic vertebrae, and the muscle is inserted into the angle of the ribs. So it is glistening tendon, slopes downwards and laterally, posterior to splenius capitis. Splenius capitis, you can see the muscle arising from the spinous process of lower cervical vertebra getting inserted into the mastoid process of the skull. Then it is inserted lateral to the angles of 2nd to 5th ribs. Dorsal scapular nerve runs anterior to it. Dorsal scapular nerve, it is a branch arising from C5 root of the brachial plexus. It runs on the posterior aspect of the serratus posterior superior muscle. Dorsal scapular nerve supplies rhomboidus major and rhomboidus minor. Those muscles, they arise from the spines of the thoracic vertebra and they get inserted into the medial border of the scapula. So the nerve is present anterior to rhomboidus muscles but posterior to serratus posterior superior. So answer is dorsal scapular nerve runs on its anterior surface. That is wrong. That is present on the posterior surface. So dorsal scapular nerve runs posterior surface and it is covered posteriorly by rhomboidus muscles and levator scapula. Dorsal scapular nerve arises from C5. The following is true about superior intercostal vein. Following is true about superior intercostal vein, except it drains 2nd, 3rd and sometimes 4th posterior intercostal veins. That on the right side drains into azygos vein. That on the left side crosses the arch of aorta superficial to the left vagus nerve. The left vein drains into accessory hemiazygos vein. So here on the right side superior intercostal vein drains into azygos vein, that is correct. On the left side superior intercostal vein, left superior intercostal vein, which is formed by the union of 2nd, 3rd and 4th posterior intercostal veins, crosses the arch of aorta and drains into left brachiocephalic vein. So wrong answer is D. So the left vein is not draining into accessory hemiazygos. How the accessory hemiazygos vein is formed? It is formed by union of 5, 6 and 7. That drains into azygos vein. Whereas left superior intercostal vein is draining directly into left brachiocephalic vein. In the previously we have seen supreme intercostal vein, that is also draining directly into the left brachiocephalic vein. So left superior intercostal vein drains into left brachiocephalic vein. The following is true about internal thoracic artery. It is a branch of first part of subclavian artery. Then it is artery entering into the thorax. It is crossed anteriorly by phrenic nerve. At the level of 6th intercostal space, it is terminating by dividing into musculophrenic artery and the epigastric arteries. Its musculophrenic branch accompanies the phrenic nerve to the diaphragm. So internal thoracic artery is arising from first part of subclavian artery that passes behind the costal cartilages, just 2 centimeters lateral border of the sternum, and then it reaches the 6th intercostal space where it is terminating by dividing into superior epigastric artery and musculophrenic artery. Musculophrenic artery passes along right costal margin. It does not accompany the phrenic nerve. Phrenic nerve ends by supplying the diaphragm. It is not accompanying the phrenic nerve. It passes along the right costal margin. So first 3 answers are correct. It is a branch of first part of subclavian artery. It is entering into the thorax it is crossed anteriorly by the phrenic nerve, and at the level of 6th intercostal space, it is dividing into musculophrenic and superior epigastric. Its musculophrenic branch is not accompanying the phrenic nerve. So it is giving rise to various pericardial branches, it is giving rise to sternal branches, and then it is passing along the left costal march. Whereas phrenic nerve, it pierces the diaphragm. Musculophrenic branch is a branch of internal thoracic artery passing behind 7th to 9th costal cartilages and traverses the diaphragm near the costal cartilage and ends in the last intercostal space. The following is true about the nerve supply of respiratory diaphragm, except each half of the diaphragm, including the crux, is supplied by ipsilateral phrenic nerve. The phrenic nerve reaches the abdominal surface of the diaphragm and supply it from its abdominal surface. The part of the right crust that lies to the left of the esophageal opening is supplied by left phrenic nerve. The 6th intercostal nerves, lower 6 intercostal nerves, they supply the diaphragm. So lower 6 intercostal nerve, so now the total motor nerve supply to the diaphragm is phrenic nerve. The sensory nerve supply, the central part of the diaphragm is supplied by phrenic nerve, whereas the peripheral part of the diaphragm is being supplied by lower 6 intercostal nerves. Here, the last option, if you see, the lower 6 intercostal nerves, motor fibers is by lower 6 intercostal nerves, it has been described. So it is wrong. Lower 6 intercostal nerves are sensory only, that supply the peripheral part of the diaphragm. The sole motor nerve supply to the diaphragm is phrenic nerve. The root value of phrenic nerve is C3, C4 and C5. So lower 6 or 7 intercostal nerves are sensory to the peripheral part of the diaphragm. Central part of the diaphragm, sensory nerve supply is by phrenic nerve. Sole motor nerve supply is by phrenic nerve. The following is true about ligamentum arteriosum. It is a fibrous remnant of ductus arteriosus. Now what is ductus arteriosus is, it is a vessel which is communicating the left branch of pulmonary artery and the arch of aorta. Throughout the intrauterine life, this ductus arteriosus shunts the blood from the pulmonary trunk to the arch of aorta because there is no need of pulmonary circulation. After birth, the ductus arteriosus gets fibrosed to form ligamentum arteriosum. So the first is true. It passes from the commencement of left pulmonary artery to the arch of aorta. So that is true. Left recurrent laryngeal nerve hooks round it. So that is also true. Deep cardiac plexus lies on its right side. So we have said deep cardiac plexus is present intervening in between the trachea and the arch of aorta. Trachea and the arch of aorta. Superficial cardiac plexus is present below the arch of aorta. So it passes from the commencement of left pulmonary artery to the concavity of arch of aorta, proximal to the left subclavian artery. The attachment of ductus arteriosus is distal to the subclavian artery. 3 branches arise from the arch of aorta. The branches arising from the arch of aorta are brachiocephalic trunk, left common carotid artery, left subclavian artery. Now the ductus arteriosus is connecting the left pulmonary artery and the arch of aorta distal to the subclavian artery. So this is a site where it is attaching. And this left subclavian, this ductus arteriosus, embryologically, it is a remnant of dorsal part of left 6th pharyngeal arch artery. So it is attached to arch of aorta distal to subclavian artery, not proximal. So ligamentum arteriosum passes from the commencement of left pulmonary artery to the concavity of arch of aorta distal to the origin of left subclavian. Fibrous pericardium fuses with the tunica adventitia of the cardiac ends of all of the following vessels except aorta, pulmonary trunk, inferior vena cava and superior vena cava. So we have said fibrous pericardium is the covering of the heart. Below it is attached to central tendon of the diaphragm. Above it is attached to roots of great vessels. It is attached to aorta, it is attached to pulmonary trunk, it is attached to superior vena cava. What about inferior vena cava? Inferior vena cava is passing through an opening present in the central tendon itself. So it does not separately gains attachment to the inferior vena cava. So it is attached to all other structures except the inferior vena cava. So fibrous pericardium encloses the heart and roots of great vessels. Inferior vena cava has already been fused with the central tendon. It is passing through an opening present in the central tendon of the diaphragm. So it does not separately gain attachment to inferior vena cava. So fibrous pericardium, below it is attached to central tendon of the diaphragm, above it is attached to roots of great vessels, that is superior vena cava, ascending aorta and the pulmonary trunk. Below, it is attached to central tendon of the diaphragm. The following is true about the nerve supply of pericardium of the heart, except pericardium and the heart. Fibrous pericardium is supplied by phrenic nerve. The entire fibrous pericardium, including the diaphragm, it is supplied by phrenic nerve. Parietal layer of serous pericardium is supplied by phrenic nerve. Parietal layer is in contact with the fibrous pericardium. So it has got the same nerve supply and blood supply as that of the fibrous pericardium. Visceral layer of pericardium is also supplied by phrenic nerve and it is sensitive to pain. Visceral layer of the pericardium is also called epicardium. It is in contact with the heart. So cardiac plexus, they supply the visceral pericardium. Pain from the muscle of the heart and coronary arteries is transmitted by sympathetic nerves. So that is true. So visceral layer of serous pericardium is supplied by means of cardiac plexus, not by phrenic nerve. So phrenic nerve supplies only the fibrous pericardium and the parietal layer of visceral pericardium. So visceral pericardium is not supplied with phrenic nerve. With the heart, it is supplied by autonomic nerves and it is insensitive to pain. The following structure passes through the posterior interventricular groove. Posterior interventricular groove. You find two structures present in the posterior interventricular. Two arteries are present. That is anterior interventricular artery, posterior interventricular artery. Both of them, they are anastomosing in the posterior interventricular groove. Then you find a vein, that is middle cardiac vein. So following structures pass through posterior interventricular groove. Right coronary artery is passing in the anterior atrioventricular groove. Posterior interventricular branch. So that option is correct. Then marginal branch of right coronary artery, that is passing along the inferior border of the heart. Then you find the coronary sinus. Coronary sinus is present in the posterior part of atrioventricular groove. In this region you find the coronary sinus. This is the right marginal vein. This is passing along the inferior border. Now what you find in the posterior part of interventricular groove is posterior interventricular artery, terminal part of interventricular artery, anterior interventricular artery, and the middle cardiac vein. So answer is B, posterior interventricular branch. Then the following are the branches of left coronary artery except. So left coronary artery is terminating by dividing into circumflex branch and anterior interventricular branches. So then conus artery and marginal artery. Circumflex branch, anterior interventricular branch, they directly arise from that. Then conus artery. Conus artery, it is a branch of anterior interventricular artery, which is supplying the infundibulum. Then marginal artery. So marginal artery may arise from the left coronary artery directly. So all of the following are the branches arising from the left coronary artery except the marginal artery. Marginal artery is arising from the anterior interventricular artery. Conus artery also arises from anterior interventricular artery. Sometimes it may arise from the left coronary artery. Following vein accompanies the anterior interventricular artery in the anterior interventricular groove. Small cardiac vein is present in the right atrioventricular groove. Middle cardiac vein is present in the posterior interventricular groove. Great cardiac vein is present in the anterior interventricular groove. Oblique vein of Marshall, that is related to the left atrium, which is present in the base of the heart. So answer is great cardiac vein, which is accompanying the anterior interventricular artery. So you can see the blue marking, great cardiac vein, which is present in the anterior interventricular artery. That accompanies the anterior interventricular artery in the anterior interventricular groove. The following is true about the right principal bronchus. It is wider, shorter and more vertical than the left principal bronchus. It enters into the right lung opposite to T5 vertebra. The division of the trachea is at the level of T4. At the level of the T4, the trachea is terminating by dividing into right principal bronchus and left principal bronchus. Azygos vein arches over the root of the right lung. So C is correct. Right pulmonary artery first lies superior and then lies posterior to it. Right pulmonary artery lies inferior to the right principal bronchus. So right pulmonary artery first lies inferior and then anterior to the right principal bronchus. Right superior lobar bronchus divides into following segmental bronchi except. So here we have said the trachea is dividing into principal bronchi. The trachea is dividing into right and left principal bronchi. The right principal bronchus divides into eparterial bronchus and hyparterial bronchus. Now these are called secondary bronchi. Secondary bronchi they divide into tertiary bronchi. Now the lung is composed of 3 lobes: upper lobe, middle lobe, lower lobe. upper lobe is divided into apical, posterior, anterior. So these are the various segmental branches given by the eparterial bronchus. Then hyparterial bronchus divides into medial, lateral. They supply the middle lobe. For the lower lobe, you find superior, anterior basal, medial basal, lateral basal, posterior basal. So upper lobar bronchi are apical, posterior, anterior. Middle lobe bronchi are lateral, medial. Lower lobe bronchi are superior, posterior, lateral, anterior and medial. Whereas for the left lung, you find only two lobes, upper lobe and the lower lobe. So upper lobar bronchi are apical, posterior, anterior, superior lingular and inferior lingular. These are the bronchi of the upper lobe. For the middle lobe, you find superior, anterior, medial is on the other side, anterior, lateral, posterior. So these are the various bronchi arising from the principal bronchus. So here we have said right superior lobar bronchus, right superior lobar bronchus. It is giving rise to apical, posterior, anterior. Lateral and medial are the bronchi of middle lobar bronchus. So here you have to remember that there are 10 bronchopulmonary segments. On the right side, apical, posterior, anterior. Middle lobe contains lateral, medial. Posterior lobe, lower lobe contains superior basal, medial basal, anterior, lateral and posterior basal. Whereas on the left side, you find upper lobe containing apical, posterior, anterior and two lingular, superior lingular, inferior lingular. Whereas lower lobe contains superior basal, medial basal, anterior basal, lateral basal and posterior basal. So here the answer is D. So rest of all we see it in the upper lobe except the lateral. Lateral, they are the branches of middle lobe. Lateral and medial are the branches of middle lobe. The following are the structures. Following structures form anterior relation to the hilum of the lung except. Following structures form anterior relation to the hilum of the lung except. You find the vagus nerve, phrenic nerve, pericardiophrenic artery and anterior pulmonary plexus. Phrenic nerve or pericardiophrenic artery. Heart is present as such in front of the hilum of the lung. So phrenic nerve is supplying the pericardium. So you find the lung like this, the right lung. Then you find the hilum of the lung. Anterior to it, you find the cardiac impression, where you find the superior vena cava impression, inferior vena cava impression. So phrenic nerve passes in between the superior vena cava, right atrium and the inferior vena cava. That is present anterior. Pericardiophrenic vessels, they should be present anteriorly, anterior pulmonary plexus. Whereas vagus nerve, that passes onto the posterior aspect. So following structures form anterior relation to the hilum of the lung except is answer is vagus. So vagus is present on the posterior aspect of the hilum of the lung. That passes along with the esophagus through the esophageal opening of the diaphragm. The following structures are related to the anterior border of the neck of the first rib. So anterior aspect of the neck of the first rib, it is related with the sympathetic chain. Then it is related with superior intercostal artery, first thoracic nerve. Superior intercostal vein. So just now we have said superior intercostal vein is draining into brachiocephalic vein. That is present in the anterior part of thoracic inlet. So it cannot come in contact with the neck of the first rib. So the structures which are related are left sympathetic trunk, sympathetic chain, then superior intercostal artery, first thoracic nerve. Vein is present, terminating by opening into brachiocephalic vein. So it is not related to the neck of the first rib. The following are the attachments to the lateral third of the 12th rib except. So latissimus dorsi, obliquus externus abdominis muscle, quadratus lumborum and diaphragm. So all these structures, they are arising from or attached to the 12th rib, but quadratus lumborum is attached to medial part of the 12th rib. Lateral part of the 12th rib, to all these structures are attached. Quadratus lumborum muscle, the muscle arises from the iliac crest, here you can see. This is the iliac crest, and the muscle is attached to the 12th rib. Muscle is extending from the below, it is attached to the iliac crest, and above it is attached to medial part of the 12th rib. Rest of all the muscles, they are attached to lateral part of the 12th rib. So here you can see the quadratus lumborum muscle. Below it is attached to iliac crest, and above it is attached to 12th rib. So the latissimus dorsi muscle also arises from the iliac crest, crosses the 12th rib, but few fibers may arise from the lateral part of the 12th rib. Oblique sinus is a cul-de-sac between. So just now we have described oblique sinus is the gap present in between the pulmonary veins. So pulmonary veins and the pulmonary trunk and superior vena cava, pulmonary veins and the inferior vena cava, left two pulmonary veins and right two pulmonary veins along with inferior vena cava. So answer is D. So it is present, it is a sinus present on the posterior aspect. So what are the boundaries of oblique sinus are? Anteriorly it is being bounded by the left atrium, and on either side it is being bounded by right and left pairs of pulmonary veins. So answer is D. So what is the sinus present behind the left atrium means oblique sinus. What is transverse sinus is? It is present in between the ascending aorta and the pulmonary trunk anteriorly, superior vena cava posteriorly. So this is what you call it as transverse sinus. The following vein accompanies the posterior interventricular artery in the posterior interventricular groove. So it is the middle cardiac vein. Small cardiac vein, where it is present in the anterior atrioventricular groove, you find the small cardiac vein. Then in the anterior interventricular groove, you find the great cardiac vein. The middle cardiac vein is present in the posterior interventricular groove. Posterior vein of left ventricle, it is not related to the groove, it is present on the posterior aspect of the chamber. So answer is middle cardiac vein. The following is true about triangle of Koch. Now triangle of Koch is an area intervening in between the, if you open the interior of the right atrium, you can see the rough portion and the smooth part. The smooth part is called sinus venerum, the rough part is called the atrium proper. Here you find the opening of inferior vena cava, then the opening of coronary sinus. This is the large vein which is opening into the interior of the heart. In between the opening of inferior vena cava, right atrioventricular orifice, and this is right atrioventricular orifice, and the opening of coronary sinus, you find a triangular area. So this is what you call it as tendon of Todaro, extending from the opening of inferior vena cava. So in the triangular area between the three, you find the triangle of Koch. In this triangle of Koch, you find the AV node. AV node is present in the triangle of Koch. So what are the boundaries of triangle of Koch is? Opening of coronary sinus, then septal valve of the tricuspid orifice, and the tendon of Todaro. In that triangle, you find AV node. So inferiorly it is being bounded by septal cusp of tricuspid valve. So that is correct. Then it is being bounded by the orifice of coronary sinus. It is correct. Superiorly bounded by tendon of Todaro is correct. Sinoatrial node is situated here. The node which is situated is AV node. Now where this sinoatrial node is present? Here, close to the opening of superior vena cava, at the upper end of cresta terminalis. At the upper end of cresta terminalis, you find the sinoatrial node. Content of triangle of Koch is AV node. So triangle of Koch is situated in the atrioventricular node and atrial connections. Sinoatrial node is situated here, just below the opening of superior vena cava, in the right margin or right wall of the right atrium, along the right margin, at the commencement of cresta terminalis. The following veins drain into coronary sinus except great cardiac vein, posterior vein of left ventricle, anterior cardiac vein, middle cardiac vein. So answer is anterior cardiac vein. Anterior cardiac vein drains directly into the interior of the right atrium. So answer is C. Left superior intercostal vein drains into left superior intercostal vein, which is formed by the union of second, third and fourth posterior intercostal veins. All of them, they join together to form the left superior intercostal vein. It arches, it crosses the arch of aorta and drains into left brachiocephalic vein. On the right side, it drains into azygos vein. So answer is left brachiocephalic vein. So here you can see the three veins are joining and draining into innominate vein. Left brachiocephalic vein is also called innominate vein. On the right side, they drains into arch of aorta. Remember, first vein on both sides drain into left brachiocephalic vein and right brachiocephalic vein respectively. So here you can see this. Left vein draining into left brachiocephalic vein. Middle mediastinum contains the following structures except. So heart and its covering is a content of middle mediastinum. So azygos vein, phrenic nerve, then pulmonary trunk, ascending aorta. So answer is, it is azygos vein is a content of posterior mediastinum. Phrenic nerve is supplying the pericardium. So it is the content of middle mediastinum. Pulmonary trunk, it is a great vessel arising from the ascending right atrium, right ventricle. So it is a content. Ascending aorta arises from left ventricle. So it is also a content. Answer is azygos vein. Azygos vein is present in the posterior wall of the thorax. That is the content of posterior mediastinum, and it arches over the root of the lung. So here you can see it is closely related to the vertebra. So it is a content of posterior mediastinum, and it is terminating by opening into superior vena cava. The following veins of the thorax are the tributaries of azygos vein except first posterior intercostal vein that directly drains into the right brachiocephalic vein. Then here you can see the right brachiocephalic vein, first one. Second, third and fourth, they are draining into azygos vein. So right superior intercostal vein is a tributary. Hemiazygos vein is a tributary. So that is being formed on the left side. Then accessory hemiazygos vein is a tributary. So what is not a tributary is first posterior intercostal vein, which is draining directly into right brachiocephalic vein. Similarly, on the left side, it drains directly into left brachiocephalic vein. This is the left superior intercostal vein, which is draining into left brachiocephalic. So answer is A. The following is true about the azygos vein. It is formed by the union of subcostal vein and ascending lumbar vein. So that is true. It enters into the thorax passing through the aortic opening. That is true. At the level of fourth thoracic vertebra, it arches forwards and opens into the root of the lung. Azygos vein is related on the right side to thoracic duct. So azygos vein on its right side is related to thoracic duct. Thoracic duct is present on the left side. Azygos vein is present on the right side. So here you can see the azygos vein is present on the right side. Thoracic duct is passing on the left side. So answer is D. So here you can see the close relationship between the two. Thoracic duct is related to the azygos vein on its left side. Here you can see all the structure which is represented in green color is thoracic duct, and this is the azygos vein. This is hemiazygos. This is accessory hemiazygos. Following is true about left principal bronchus except it is narrower, less vertical than the right principal bronchus. It enters into the hilum of the left lung at the level of 6th thoracic vertebra. It crosses anterior to the esophagus, thoracic duct and descending aorta. Left pulmonary artery is first inferior and then posterior to each. So answer is left principal bronchus is first below. Left principal bronchus is first anterior and then superior. So here you can see that left pulmonary artery is related first in front. Supraventricular crest. Supraventricular crest is situated in. Supraventricular crest is a feature of right ventricle. It separates the two parts of the right ventricle. So there is the inflow part and the outflow part. So it is not at all a feature of left ventricle. So option A is wrong. Then right ventricle between the leaflets of tricuspid and pulmonary walls. That is correct. Between the muscular and membranous part of interventricular septum, between the bicuspid and tricuspid walls. So supraventricular crest, here you can see, this is the inflow part which is rough. This is outflow part is smooth. At the outflow part you find the aortic walls. At the inflow part you find the tricuspid wall. So it is present in between the pulmonary walls and the atrioventricular walls. In this region it is present between the inflow part and the outflow part. So answer is B. Bicuspid and tricuspid walls, these are not at all related. It is a thick muscular, highly arched structure extending obliquely forwards and to the right, where it is present in between the inflow part and the outflow part. It separates the tricuspid wall and the pulmonary walls.